So when this joint becomes inflamed, there are frequently instances where that inflammatory fluid penetrates the very thin surface of the bone and then stimulates the nociceptors covering the bone on the external auditory canal. At which point, when those sensors are stimulated, a message is sent to the brainstem saying we're inflamed, and it hurts, and the patient perceives that it's an earache because the pain is actually coming from the external auditory canal, and usually very deep inside the external auditory canal, and they claim it feels like a earache, a deep ear pain. So let me see if we can then come out of here and I can show you this on a fixed skull. It's not going to be perfect, but hopefully you can see this enough. It's hard. I tried to get a light down in there, but it's almost impossible to get enough light down in there. But as you can see, this is the glenoid fossa, the condylar head of the ball and the socket. You can see how close the condylar head and the glenoid fossa is to the external auditory canal, which doesn't run perpendicular inside the head. It runs anterior, from here, anteriorly. That's why when you put that little Q-tip in your ear, it doesn't go very deep if you go perpendicular in the auditory canal, but you can go all the way to the tympanic membrane if you come from posterior to anterior. So about 5 millimeters down inside this external auditory canal, there's that area of paper-thin bone that separates what's called the glenoid fossa, socket part of the ball and socket, between the joint itself and the external auditory canal. And when this joint becomes inflamed, that inflammatory fluid and exudate can penetrate the bone itself, stimulate the nociceptors, which are the receptors creating pain, and the patient will present to the ENT doctor, to the walk-in clinic nurse practitioner, physician's assistant, to their PCP, and say, I have a bad earache. And generally speaking, a otoscope is used to examine the ear canal, and usually nothing is seen.
Ask your dentist if they are a TMJ Services provider.